Parkinson's disease is the result of dying brain cells that control movement and coordination. This leads to tremors and difficulty with walking and movement. Parkinson's disease most commonly affects the elderly. Onset is usually after 50. Men are affected more than women. It occurs in younger adults, but rare in children. The main cause is dopamine deficiency due to dying brain cells. Dopamine controls movement that sends signals to muscles. Symptoms. Primary symptoms include tremor at rest, muscle rigidity, stooped posture, expressionless face, slow movement, and poor balance. Postural instability leads to a stooped posture position, with head bowed and shoulders drooped. Patients may have a tendency to lean forward or backwards, causing injury. Arm swing is diminished or absent. Patients tend to take small shuffling steps due to lack of communication due to dopamine deficiency. Bradykinesia is slowness of movement or absence of movement and is one of the classic symptoms of Parkinson's disease. Over time, a person with Parkinson's disease may develop a stooped posture and a slow, shuffling walk. Parkinsonian gait is the distinctive unsteady walk associated with Parkinson's disease. There is a tendency to lean unnaturally backward or forward, and to develop a stooped, head down, shoulders drooped stance. An expressionless face or facial masking is due to rigidity from the loss of dopamine sending proper signals to muscles of the face. Rigidity may produce pain and is increased during movement. A tremor is the involuntary, rhythmic shaking of a limb. It can also affect the head and even the entire body. It is the most recognized symptom of Parkinson's disease. Parkinson's disease commonly affects smaller muscles first. A tremor often starts with an occasional tremor in one finger that eventually spreads to the whole arm. The tremor may affect only one part or side of the body, especially in the early stages of the disease. Not everyone with Parkinson's disease has tremor. This is an example how the handwriting is affected in a Parkinson's patient. Pill rolling is a tremor characterized by back and forth rubbing of the thumb and forefinger. Parkinson's disease diagnosis is based on history, signs, and symptoms, ruling out other disorders that may produce similar symptoms. Patients must have a primary symptom, but in some cases diagnosis is made by observing symptoms as they occur and as symptoms are established over a period of time. A scan is used to rule out other disorders like a brain tumor, stroke, or focal lesions that produce Parkinsonian symptoms. It may be difficult for the radiologist to diagnose early stages of Parkinson's. There are no blood tests available for diagnosis of Parkinson's disease. The treatment of choice is levodopa.